Zach, I was like walking the door here, and Zach was like, "Hey, you want to just leave this in my office?" I was like, "Sure." And then like they sit there, I was like, realized like 5 minutes, I think. Sorry.
Oh, okay. Oh, okay. So can y'all hear me? Everyone's okay. Gotcha. Great. Sorry for that. I'll reintroduce our great speakers. So thank you all for joining us again today. We are so pleased to continue Community Impact's speaker series on service leadership and insights into what makes great leaders with a service lens. And I'm excited to introduce you all today to Donald Jonas. So I thought I'd do a brief background and give Donald a chance to talk about his current role a little bit. And then we'll spend the majority of our time talking about influence, focus, and his thoughts generally on leadership. Hopefully we'll have a few minutes at the end for Q&A too. So looking forward to the discussion. But Don, thank you so much again for joining us. So for background, Don serves as Vice President of Social Impact with Advocate Health, which is one of the nation's largest healthcare systems, serving millions of patients across North and South Carolina, Georgia, Alabama, Wisconsin, and Illinois. He is responsible for advancing Advocate Health's enterprise strategy to address and improve the social drivers of health that have a profound impact on individual and community health. Don's previous experience was chief executive for one of the oldest and largest nonprofit healthcare agencies serving individuals with limited resources in the Carolinas. And he previously held senior leadership positions in philanthropy, including executive director for Novant Health's Presbyterian Healthcare Foundation and senior vice president for Community Philanthropy for the Foundations of the Carolinas, which I don't know if any of you in the room have been to their office in downtown Charlotte, but it's so beautiful.
Yeah,
it's lovely. It's got a public art gallery, so consider it. And he's passionate about building long-term partnerships to improve lives. So thanks again for joining us.
Thanks for having me.
Well, why don't you, just to orient us, give us a little bit of insight into your current role and some of your initiatives.
Yeah, sure thing. Thanks so much for this opportunity. I appreciate it. And those of you online, hello. I'm Don Jonas. I'm a native Charlottean. I'm currently with Advocate Health. So Advocate is the parent company for Atrium Health and Advocate Aurora from the Midwest. So we did a strategic alignment a year and a half ago now. I've been with Legacy Atrium Health for almost exactly 4 years. So I came here, as Molly mentioned, I was with a Care Ring. It's an agency here in town that provides health and wellness services for people without public or private insurance. We have a clinic that we haven't been there 4 years. They have a clinic, it's uptown, that serves people directly, a very large population of folks experiencing homelessness, about 7,000 or 8,000 people a year. Coordinated care, specialty care from providers across the region, and had a home visiting program called Nurse Family Partnership. So I was loving that work, but I was recruited over to Atrium Health for this position I'm in now, which is leading our system's social impact strategy. And this was something I was kind of wanting to get to that next level of trying to make a bigger strategic impact across a broader population. So my work, I lead a team within the Advocate National Center for Health Equity. This is a new entity. It's being established for enterprise engagement on health equity issues. And my particular team is working on social impact. And we've prioritized 3 core areas around food and nutrition, affordable housing and homelessness, and career development and employment. But we end up doing a lot of work in partnership with others. So for example, we're working on an initiative right now with our environmental sustainability teams around a food sustainability strategy. So just as one example, if Atrium Health, we have, I think, 75 different hospitals across our system. I heard yesterday or this week that 1 out of 50 people in America are cared for by Advocate Health now. So we have this scale that we didn't have previously when we were just the hospital in Charlotte. If we were a restaurant, for example, we would be the largest restaurant chain in the state of North Carolina. We serve more food to more people every day than anybody else, and yet we're not acting like it. So we have a chance now that we can influence supply chains and like the types of food that's being served in our kitchens and the ways that we rescue food and distribute it out to communities that might need it. So my team is leading that strategy work, and a lot of it is based around establishing a strategy for us on how to do it, but then we have to implement it. I have a little team that just does, 3 or 4 of us that works on the strategy, but we have to work really closely with community engagement, with community health, with our clinical teams, with community health workers, with facility directors to, bring that strategy to life. And I got a lot of things I could share with you. One example for this afternoon, I'm going to be working on within our facilities, lots of service line leaders, they recognize that there are food insecurities amongst their teammates in many cases, but certainly among their patients. And so they've started to create these little food pantries within our facilities. But as we've grown so fast, there's no cataloging of where these food pantries are. In some cases, I've learned within one of our own hospitals, there are 2 or 3 of these pantries that the facility executive isn't even aware that's occurring. So I love the creativity and the desire to give back, but we don't know how these operate. We don't know how they're sustained. We don't know how, our team's been tasked with, we need to figure out how do we do an emergency food pantry that's most effective and most sustainable, whether it's in a large metropolitan area or a more rural hospital. So a little quick overview of some of the work that I do.
That's great. Well, and you started to already touch on it, that influence is a large part of your efficacy in your role. And I would think being able to tap into the skill sets, the core capabilities of what people do, as well as their motivations, and pull them together to accomplish your initiatives is a key driver of your success.
Yeah, I mean, I think it's essential in a lot of different ways. When I started 4 years ago, this was right in the teeth of COVID. You know, I was hired in all on Zoom, never met anybody personally. And within the first, month or two, as I was there, one example, I was driving around uptown Charlotte where they had the tent city. I don't know if those of you were here, you saw it right off of 277. And I mentioned to my boss who had just hired me, what are we doing as a system with this, there are hundreds of people that are in that encampment. And she said, I'm sure we're doing something, but I don't really know for sure. What could you help me do a little research project? You're here. What is our behavioral health system doing? What is our community health team doing? Do we have street medicine going on? How are we engaged as a system in that? And so it was a great, I felt like I was a freshman in college. I was knocking on doors virtually, hi, I'm the new guy. What's behavioral health doing? How is our children's service line? And I ended up putting this little package together of here's all the different things that we're doing that are not connected together yet. Timing was fortuitous because at that time, if you remember, they had to very quickly disassemble that encampment. It was controversial and maybe it was done too quickly, but it was becoming a public health hazard. But as they moved out, Mecklenburg County, we technically still report to Mecklenburg County, this giant place that has in 6 states, but we still have to have a meeting each year with the board of Mecklenburg County to approve our work. The chair of the board went to our CEO, this is a couple months after I'd done my little work project, and he said, hey, Gene Woods, who's our CEO, said, I want you to co-chair an effort to try to address homelessness in our community. And at that point, Gene Woods called my boss and said, how are we going to do this? He goes, I got just the guy. He just did this research project. And, I didn't really know anything about homelessness, but I knew about how to serve people that were in poverty and had needs. Fast forward to that, it led to the creation of the Home for All plan. I don't know if you've tracked this work. This is Gene Woods and Kathy Besant, who at the time was a senior executive at Bank of America and now runs Foundation for the Carolinas. Gene and Kathy came together to create the very first ever comprehensive approach to homelessness in our region. So it's a Home for All is a way to try to make homelessness rare, brief, and non-recurring through bringing together multi-sectors, faith community, public sector, private employers, the affordable housing community that doesn't oftentimes talk with homelessness, to have a comprehensive way to address homelessness. But I share that story not to pat myself on the back in any way, but to say, because I had these sort of connections in the community, because I had worked at Caring, I knew when my patients came to me then, I had to have a connection to Dream Key Partners, for example, if somebody was ready to move into affordable housing, or to crisis assistance ministry if somebody couldn't keep the utility bill paid and needed to stay where they were. I had to utilize those connections out in the community to try to make those sort of interventions work. So
that's excellent. And I'm curious, across your teams of folks that work at Advocate Health, their business focus is not often, aligned with your initiatives. Yep. How do you pull them into your work and help them be champions of your causes when, how do you convince them to care about what you need?
Yeah, that's a great question. And I'll maybe turn it just a little bit based upon what I was sharing with you a minute before we started. As I was walking out, I live like a mile down the road from here, so it's easy to get here. But as I was closing up my laptop to come over here, I got a note from our emergency preparation team. And they said, Don, we need you later this morning. So as soon as I'm done here with Hurricane Helene that has hit, I don't know if you guys you've probably seen the visuals of it. It's horrifying what's occurred across the Southeast, but in particular in the western part of North Carolina. I was telling Molly, my sister teaches at Warren Wilson College, which is up in the Swananoa area, which it's just been absolutely devastated. But so we've got teams that were up there really as I'm learning Friday afternoon, Saturday morning, trying to assess how we can help. We've got a mobile medical units there. A lot of folks are now, they can't utilize some of the hospitals, some of the more rural hospitals. Even their backup generators are not working. And so we're sending folks to our hospital system. Some are coming now to Charlotte. And even just last night, there was a patient, as an example, that got treated and was going to be released, but there was no home to go back to, and there was nowhere to send them in Charlotte. And so this is sort of I think it's a canary in a coal mine where that's not the first patient. There's gonna be many more. And so I received an email saying, I need you and the community health team to lead our strategy of what are we gonna do with these people that have suddenly shown up in town, because we have built these connections with the homeless services community. We've talked with Nourish Up, which is the food pantry for our region. We know the behavioral health providers in our community. It's gonna take a little bit of putting things together here over the next couple of days, but we are seen as sort of, because of the work we've done previously, as that connector of that. It's like what's the civic switchboard? Remember that the old days? They plug you in. Like our team is kind of that civic switchboard. I don't really know how to clinically help someone, but I know how to connect that person to someone that provides behavioral health services, or to a respite care for someone that just needs a place to go for a couple days after they leave. So there's like tactical, tangible stuff that our team has to do, which is based upon making connections across our system, but it's also layered in by a broader strategy of how we do this work. So it's not just a one-time fix, but how are we going to do this, unfortunately, with Helene for the next weeks, months, for a very long time. We're going to have this challenge.
Yeah. Well, you're touching on connections and partnerships, and clearly that's a big piece of your role, is being the connector among your entity and the community. And I'm sure in your role, there are a lot of smaller organizations that want to partner with you. So I'd be curious if you could share with us, when have some of the smaller ones, less impressive on paper, been able to convince you that the partnership is worth your time?
It's a great question. One of the things that we have now with our corporate social responsibility team. So I'm within the community and social impact division. So there's government relations that's there. There's the Advocate National Center for Health Equity, where I'm aligned. And then there's our corporate social responsibility team. So they're the ones that are overseeing our volunteer opportunities for our grants program. But in theory and in practice, we work hand in glove together as a team, even though they're in a different silo within community and social impact. So as groups come to us or get on our radar, we've established a screen for us to look at when we think about food, housing, and employment. We've got these 10 sort of key areas that we want to see that are in place for us to move to the next step of thinking about a partnership. So I don't have all 10 of them for you now, but for example, the first one is their alignment. Is the mission of this group in alignment with our mission? We have this for all mission that we're here to serve everyone, health, hope, and healing for everyone. So we want to make sure the groups we're working with have a similar mission. Is the intervention they're talking about, or the program or the organization we're talking to, can they scale this? We don't want to do something that would just work in South Charlotte but may not work in Winston-Salem or rural Georgia. Is it innovative? Can we learn from it? Is the intervention based on data that we can assess, so we can see that it's not just sounds like a good idea? Is it something that we could actually do as a system? So we've got this sort of screen that our pop health people, our corporate social responsibility teams, even our community health are starting to utilize that screen. And it's not a highly detailed screen. It's more of like thematically, do we feel comfortable that this organization that's approached us lines up in most places with where we want to be as a system? So that helps us. Candidly, there's also the old, somebody in the neighborhood happens to know the EVP for Hospital XYZ, and their Cub Scouts has a weenie roast and they wanted to come. And that comes to us and say, Don, we just have to do this. And there are occasions where that still occurs, but we're trying to really align our investments with our social impact priorities. We also have clinical health equity priorities. So sometimes there are partners, even smaller partners, that are in that space. So there's clinical priorities around cardiovascular disease. So there's some things that groups that are associated with heart health that we'll work with. We're looking at infant and maternal health. So there's a variety of different groups that do that kind of work that might resonate and align with us. And then the third one is violence-induced injuries. So there's a lot of different groups that are trying to prevent violence in communities, and that we've learned a lot about how to engage on this and to help patients that have come into our system. We have this hospital-based violence intervention project, which is really kind of a innovation for hospital systems that started here around once someone comes in and they've been a victim of violence, we wrap community health services around that person to try to prevent them from going back to the situation they were in, which there's a huge sort of recidivism of people going back to violence and creating violence. So we're getting some data back on how this really helps to be more, intentional and strategic about preventing it. So
that's great. That's great.
Yeah.
And thinking about your framework of food, housing, and employment, I think that's a good point to kind of shift our conversation a little bit to focus. And clearly, I'm sure everyone in the room and listening can agree that there are just so many priorities for you. And they emerge on a daily basis. And you also have been in an interesting position of you were at Atrium when it merged with Advocate and suddenly quadrupled in size.
Right.
So very curious for your thoughts on how do you continue to find focus in this very ever-changing, ever-crisis-driven world, and particularly given your increased purview for your department?
Yeah, it's really hard because as you said, within those three buckets, there are thousands of things we could be doing. We created a theory of impact within food and housing and employment where, overly simplifying it, but we look at where are there currently health disparities. Let's take food as an example, that are in our communities, and what's our ideal state we want to get to where we have full access to food and nutrition. And for food, for example, we look at it in sort of a continuum. We want to move and we want to be engaged where we can. Initially, if somebody is hungry from a humanitarian impulse and the right thing to do, how do we provide food to someone? So I mentioned earlier the food pantries. That's great that we're doing it. It's not strategic yet, but we need to be in that space. If somebody's hungry, family can't eat, they need to be able to get food, and we need to be able to help them. But we don't want people to be reliant on food banks and charity forever. So how can we help people sign up for SNAP benefits if they're eligible? Or, how can we get them engaged with their local food bank for a longer term supply of food for their families? So as we move up that continuum where we really want to eventually go, and we're starting to do work, is really looking at nutrition security. So how do we disrupt the whole systems of the way food is provided in our country? I mentioned the scale we have now, we have some influence on that. One of the things that we're trying to do is to create a strategy and a system so that local food that's produced by local farmers can get into our kitchens. It's hard to do it in a one-off basis when we're in the Southeast. We work with Sodexo Magic and these massive, big food suppliers who they have their own systems we have to work through. It becomes easier if we can bring to Sodexo Magic, a coordinated way to approach bringing food in a region and getting it into our kitchen. So the Carolina Farm Trust is an example. I don't know if you've heard of that group. They're creating a regional distribution center in Charlotte on the west side of town. They already have 20 different farmers that are able to get the food into them. And then once they're there, we could work with CFT, Carolina Farm Trust, to get that food into our kitchens. There's a similar group we've learned about in Atlanta called Common Market. They do a similar kind of thing. So we're just trying to figure out ways to do our work that advances that broader theory of impact. And we see different ways that we can plug in as we do it. I would say undergirding all of this, at least from the social impact side, is what are the policy levers we can pull to try to improve these conditions? So we work with our government relations team. They have some external counsel that are helping us establish our federal policy advocacy priorities as a system. Usually we just look at traditional clinical and medical issues. This is really the first year that we're going to actually have priorities on food and housing and employment at the federal, the state, and the local level for things we want to do. I don't know if you track things, for example, the Farm Bill that is massively important, still hasn't been passed. There's a variety of different things we can do in housing on extending additional vouchers for people. Historically, we just say it's not our purview, but I think there's a recognition definitely within our system, but I think broader in healthcare, that if you don't have housing, it's almost impossible to be healthy. If you don't have access to food, it doesn't matter how wonderful we are as clinical interventionists, someone's going to come back to us. So we have to be engaged on that policy side. So that's a sort of a core element of our overall theory of what we want to do as well.
Excellent. That's great. We'll be mindful of time. I'm going to give you some quick hits and then hopefully have a few minutes for questions. That sounds good.
Sure.
Okay. You have been in a unique position of serving the community in a more revenue-driven entity, a huge hospital system.
Yes.
I'm curious if you can tell us a little bit about the dynamic of, kind of profitability mentality in the nonprofit community and what lessons you've learned through service leadership that you've kind of pulled into kind of a more profit-driven entity.
Like what I've learned from the nonprofit space.
Yeah,
and
what you've learned.
now. Yeah. I mean, I've learned a lot. Maybe I come at it somewhat from a unique position where I am now in that, and you alluded to it in my career. I mean, I came out of, I got a PhD in political science. I was going to be a college professor, and then I immediately moved and worked at a think tank. And I did some work on the future of America's workforce, and Robert Wood Johnson, we did a book on the future of healthcare. So I had this sort of like theoretical, almost an academic approach where I was interested in these topics. And then I worked on the giving side with Foundation of the Carolinas. So I was responsible for making donations in the greater Charlotte region for the foundation. So I've had this perspective as someone that gives money out. And then I was at Caring, which is it's a large nonprofit, but compared to Caring, it's a tiny little dot. I mean, we serve 7,000 people. Caring serves 7,000 people. Advocate Health, again, we serve like 6 million patients in 6 states. And so it's a totally different scale, but those lessons from how you do this work in a nonprofit agency, I think help to inform my work where I am now. So I've had this advantage of kind of thinking about these sorts of issues for a long time, of being a donor that's got to assess a nonprofit, and then being that nonprofit that's trying to plead across the table for money for the work that I want to do. And what I've tried to do internally with my teams and with other leaders of community health and community engagement and government relations and others is to try to help them see that while we're this large entity that has all these employees in all these different places, we don't always have the right answers in communities. And I'm actually, in some ways, I'm sort of surprised that I got this job, because in some ways when I was at Caring, I used to complain a lot about the large healthcare systems. I think they can just come in and they have all the answers, and they don't understand really our people that we serve. And so I've seen some of that shift over the last few years I've been here, but it's important that we have a recognition that we can't just go into a community and say, we know how to do behavioral health, we are the world's best at XYZ intervention, if we don't truly know the community, if we don't actually know what they need and what they want. And we're learning that in real time in a lot of places. We're doing some work in Wisconsin to build a health equity center in an underserved part of Milwaukee on the near west side. And I think initially we kind of had that mentality, and I'm probably to blame as much as others. I thought, well, we're so big and we're so smart. They don't know yet how great we are and what we can give them. And we started having community dialogues and conversations and focus groups, and kind of realized what we thought they wanted is not actually what they wanted. And what they really needed in this particular case is access to dental care, which is not something that we necessarily do, but we can influence and help to get there. And they really needed more access to food. The local Family Dollar and food bank had left. There's no food in this place. So while we thought they needed all these clinical things, they actually need clinical things we don't provide, and other things that we can influence and we can help to get, but is not a part of our core function. So
creative problem solving, big part of your job.
Yes, that is totally
great. One final question, then I'll open it up. If you don't mind sharing, I hope I'm not putting you on the spot with this, but you were telling me you've got an interesting connection to Habitat through your mother, and Habitat is one of our companies. We've got a big relationship with them as a partner, so I'd love you to share that if you don't mind.
Yeah, sure, totally. So when I was a little kid here in Charlotte, my mom was essentially a social worker. I mean, she had a master's in theology and stuff, but she taught some in public schools, but then I think she found her real calling. She worked at Christ Assistance Ministry here in town, and then she worked at Habitat for Humanity. This is in the mid 80s into the early 90s. She was at Habitat. She was a family resource specialist. I mean, so when families were identified that could be Habitat homeowners, she worked with them on all their different life needs they would have once they moved into a house. And this was in 1989 or 90, and they had just finished one of their Habitat houses here in Charlotte. And she and the executive director and another woman, these three women, one and my mom, were sitting around saying, we're exhausted. What a great build. We got this one done. But why don't we try to do a house where it's only women that build the house? And, they mentioned it to the board, and they were like, you're crazy. There aren't enough women contractors. There aren't enough women paint. We could never do that. And they said, damn it, let's do it. And so they did. They did the very first women's build for Habitat for Humanity was right here in Charlotte. And when they finished it, Rosalind Carter came in, and it got a lot of attention. And it was amazing that it spawned this like global movement of there's women builds now in hundreds of countries, and they're happening every day around the world. And it's great for me because I didn't really know my mom was doing that. I was a knucklehead kid growing up doing stuff, but she would drag me to Christ Assistance Ministry to sort clothes, and she would tell me about the stuff she was doing at Habitat. And she passed away earlier this year, and Habitat was so sweet. They came at the reception, they had these 2x4s that you could write little messages to my mom, and people did it. And so I was able to bring my family. I have 3 kids now in college. My wife and we went out to contribute to one of the houses that was built, and we got to put the 2x4s into the building. So there's a family that they just moved into the house like a week or two ago. And, we know that she was part of that. Sorry.
Amazing. Great.
Sorry.
No, thank you for sharing that.
Caught up there.
Right. Well, any remaining questions, thoughts before we wrap up today? That was a beautiful way to end it from my perspective. Yeah. All right. Well, if everyone could please join me in thanking Don for his time and his insight.
Sweet. Thank you.
That's all. Great.
One question from my end. I think a lot of us, the reason we started Community Impact is, I think a lot of us, you spend a lot of our time thinking about how to excel at work and maybe feel a little bit of a gap on great. And how are we contributing back to the community, and how can 3 Ships be a little bit of a facilitator in helping our leaders across the portfolio think about how we're giving back. Feel free to pitch us, but are there ways with your particular kind of mandate that, folks like us in the Charlotte community can think about getting involved, donating, helping, supporting?
So many ways. Do you have priority areas that you want to be engaged in? It sounds like housing, affordable housing.
So each of our companies has causes that are selected, like our Home Solutions is our biggest portfolio company, and Habitat is their main partner. So strategically, yes, but in terms of the folks that, particularly there's some in this room who are joining boards of nonprofits through Community Impact that I'm helping them do.
Sure.
It's self-motivated, and it's personal passions first.
Yeah, sure. I'd love to have a conversation with you all, and we can bring in our corporate social responsibility and community engagement teams. It's endless what we could do together. I was telling Molly about how, and I may have mentioned with you guys, these are running together now. I've got to work on getting people connected to homes like immediately. And so we need help identifying partners in our community that want to help with this, but there's also lots of different ways that we're going to need volunteers to assist us. So I know I was on a briefing yesterday. There was a medical director in the Winston-Salem market that they were doing things as simply as putting together essential need packets, and they were working with our logistics folks to get those sent up to Western North Carolina. There's lots of different ways that, tomorrow, this afternoon, I could get you all engaged to kind of help with that sort of work. So it really depends on where it's most amenable to you all to get engaged. There's actual tangible hands-on things that we're a part of. There's additional nonprofit groups and organizations that we care about that we want to have people engaged on. A Home for All is a good example. I don't know if 3 Ships is.
No, I've listened to some of the conversations, but not.
There are multiple ways to get involved if homelessness is something you care about. They have sort of these 3 different platform areas around people, prevention so I can't think of and production. Like we don't have enough housing. We don't have enough of a focus on preventing homelessness, and we don't focus on the individual who's experiencing homelessness. We work on the providers, and they're coordinated in lots of different ways, but we got to do a better job of helping an individual who's experiencing homelessness. So I'm on this technical committee for the United Way, which is masterminding, overseeing this whole work. But we can get you plugged into that if that was something you care about, because that matters to us, the system. And the only way the Home for All works is if we get everybody kind of all in, assisting. So I'm happy to have an ongoing, continuing conversation with y'all if there's interest there.
Yeah, and I'm happy to be a resource. Reach out to me, anyone in the room or listening remote who wants to be connected to Don and learn more. Anyone in Raleigh have any questions? Lee, nice to see you.
Nice. Just a quick hello. Great story at the end. We loved your mother very much.
It's very sweet. Thank you. Oh, Lee, what are you doing? That's Lee.
Yeah.
Oh my gosh.
So Lee is my mentor who introduced Don.
I've known Lee forever. Y'all have a good man. Oh my gosh.
I'm not with Three Ships, but Molly and I have been friends a while, and she invited me to listen in. And you guys are talking to the best second baseman the Little League in Charlotte has ever known. So
I like it.
My brother Rick lives up in Asheville. He's come home to live with us because his place is not in a good place. We were just talking about Harry and Bryant Little League last night. The fact I was at second base because I had my arm was the worst on the team. I could barely even throw it to first base. So it wasn't like I was any good. I was just like, they got to find a position to put him in.
That's awesome.
Thank you so much.
Yeah, thanks, Raleigh. Thanks, everyone, for being a part of this morning. Appreciate it.